Advice for people diagnosed with diabetes mellitus. Disclaimer: the information presented on this channel is for informational purposes only and is not intended for diagnosis or treatment. All advice is based on the experience of medical professionals, but does not replace consultation with a doctor or medical treatment. Always consult your physician before applying any recommendations. This channel is for information only. It does not replace professional medical advice. Always consult your doctor before making changes. Brief introduction. Living with diabetes is not the end of the world. It's the beginning of a new way to take care of yourself. Millions of people across the globe live successfully with this diagnosis. The key is proper management of the condition. Remember that diabetes is manageable. You can live a full and active life. Lifestyle. Moving on to your daily routine. Daily schedule. Eat at the same times every day. Wake up and go to bed on a consistent schedule. Space your meals evenly throughout the day. Sleep. Aim for 7-8 hours of sleep each night. Keep your bedroom peaceful and quiet. Avoid caffeine in the evening. Important: lack of sleep can raise your blood sugar. Avoiding stress. Make time for relaxation. Practice your hobbies. Maintain social connections. Risk factors. Stop smoking. It doubles your risk of complications. Keep your blood pressure in check. Monitor your cholesterol levels. Nutrition. Next, let's discuss healthy eating. Basic principles. Eat regularly, don't skip meals. Control your portion sizes. Choose foods with a low glycemic index. Include fiber in every meal. Healthy foods. Vegetables: broccoli, spinach, cucumbers, tomatoes. Whole grains: buckwheat, oats, brown rice. Lean proteins: fish, poultry, beans. Healthy fats: olive oil, nuts, avocado. Remember that a Mediterranean diet is a great example of balanced eating. Foods to limit or avoid. Sugar and sweets. White bread and pastries. Sugary drinks. Fried foods. Please note, avoid foods with added sugars. Physical therapy. Moving on to physical activity. It's your best friend for diabetes control. Recommendations. At least 150 minutes of moderate activity per week. Spread your activity over at least 3 days. Add strength training 2-3 times per week. Important: exercise lowers your blood sugar. Examples of exercises: brisk walking, swimming, biking, dancing. Bodyweight strength exercises. Restrictions. Start slowly if you're new to exercise. Avoid strenuous activity if your blood sugar is very high. Always check with your doctor if you have complications. Remember that even a 10-minute walk after a meal makes a difference. Hardening conditioning. Next, let's talk about conditioning your body. Methods. Alternate hot and cold showers. Fresh air baths. Outdoor walks in all seasons. Benefits: stronger immune system. Better circulation. Improved metabolism. Precautions: start gradually. Always check with your doctor. Avoid these methods if you have heart problems. Please note, hardening practices are not a replacement for medical treatment. Breathing exercises. Moving on to breathing techniques. Diaphragmatic breathing. Place one hand on your chest, the other on your stomach. Breathe in slowly through your nose, letting your belly rise. Exhale slowly, pulling your belly in. 4-7-8 technique. Inhale for 4 counts. Hold your breath for 7 counts. Exhale for 8 counts. When to do these: 10-15 minutes daily. Before bedtime to relax. Anytime you're feeling stressed. Important: Breathing exercises lower stress and help control your sugar. Mental aspect. Next, let's discuss emotional support. Relaxation techniques. Progressive muscle relaxation. Meditation. Visualizing peaceful places. Psychological support. Don't hesitate to reach out to a counselor. Join a support group. Share your feelings with people you trust. Motivation. Set realistic goals. Track your successes. Celebrate small achievements. Remember that a positive attitude makes diabetes management easier. Additional information. Finally, let's review some other important aspects. Medication support. Take your medicines exactly as prescribed. Keep a medication log. Never stop treatment on your own. Social support. Teach your loved ones to recognize symptoms. Tell colleagues about your diagnosis if appropriate. Build a support network. Self-monitoring. Regularly check your blood sugar. Keep a symptom and wellness diary. Consider using continuous glucose monitoring systems. Doctor communication. Prepare a list of questions before visits. Share honestly about any challenges. Don't be afraid to ask for clarification. Important, preventing complications. Schedule regular eye exams. Get your kidneys checked. Inspect your feet daily. Monitor your blood pressure. Please note, early detection of complications saves lives. Remember that diabetes is a marathon, not a sprint. Consistency matters more than perfection. You can live a full and happy life with diabetes. Thank you for reading our advice. However, remember to consult your doctor before following it. Take care and stay healthy.